The history of angina. The first documented incidence of angina in history comes from sometime during the 17th century by the biography by Edward Hyde. He described and detailed the disease known as angina today, experienced by his late father, although he did not use the term in his biography. Dr. William Herberton documented the first detailed account of angina sometime during the 18th century. He used the term angina pectoris in his manuscript and is credited with the naming of this disease. Incidence. The incidence is an estimate of how many new cases of a disease develop in a population at a given time period. Prevalence. Prevalence is an estimate of how many people have a specific disease, condition, or risk factor at a given point in time. The American Heart Association reports that almost 9 million people in the United States experience angina. They also report that angina is more prevalent in women than men. An estimated 10 million people in the United States suffer from angina. According to the Framingham Heart Study, an estimated 500,000 new cases of stable angina are reported each year. The estimated age-adjusted prevalence of angina in women aged 20 and older is 4.1% for non-Hispanic white women, 6.7% for non-Hispanic black women, and 4.5% for Mexican American women. Also, the estimated age-adjusted prevalence of angina in women and men aged 20 and older is 4.1% for non-Hispanic white men, 4.4% for non-Hispanic black men, and 3.5% for Mexican American men. Mortality. Mortality figures are the most accurate data available for assessing the impact of cardiovascular disease and stroke. Statistics regarding mortality with angina are invalid because most deaths are reported as cardiovascular disease and stroke, which may skew the data. Risk factors. If you're at risk for heart disease or coronary artery disease, you're also at risk for angina. The major risk factors for heart disease and coronary artery disease include unhealthy cholesterol levels, high blood pressure, smoking, diabetes, overweight or obesity, metabolic syndrome, inactivity, unhealthy diet, and older age. The risk increases for men after 45 years of age and increases for women after 55 years of age. Also, family history of early heart disease is also a very high risk factor.